Hi, everybody. Today we're talking about things that caregivers have in common. Over the past week, I've had a lot of discussions with caregivers saying that their situations are stressful and difficult. And it's interesting, many of these situations, some of the aspects are very much similar, and in some, they are a little bit different. I'm Pamela D. Wilson. My website is pameladwilson.com. There is a lot of helpful information for all caregivers on my website and in my weekly radio programs. In this video post, there is a link to my podcast program. It is called Spreaker. All of the podcasts from the past year are there for you to listen to. They answer many questions that caregivers have in common. So let's talk about the commonalities. Many caregivers want to be understood. They want to be able to tell their story, which is important because their story involves why they became a caregiver, how they became a caregiver, who they're caring for, whether it's a husband, a wife, a mother, a father, a brother, a sister, a cousin, aunt, uncle, grandparent. So caregivers first want to be understood, which can be difficult for people who are not caregivers because they don't understand the situation and they may not be as patient, and sometimes they just may not be as interested. I don't know if you remember when you had children, but if you had children and a friend of yours didn't have children, it may have been difficult to maintain those relationships because you didn't have a lot in common after you have those children. Caregiving is similar. Caregivers understand other caregivers. People who aren't caregivers can sometimes be empathetic, but they really don't always understand the entire situation. Next thing that caregivers have in common is we all want good care for our loved ones, but sometimes we don't know how to get good care because we're not used to working with the healthcare system, which has different guidelines and different regulations than we would like sometimes. And we're just thrown into situations that we've never been in before, so we don't know what to do. And here are some differences there. So male caregivers, according to research and my practical work over the last 20 years, find it a little more difficult to do personal care for a female. So those are things like bathing and managing incontinence. And then on the other hand, we have spousal caregivers who feel that their situations are very different because they're focused on caring for a spouse. Many of those can feel very alone and isolated because, in a sense, they sometimes have given up their life outside of that marriage. They've not maintained any friendships or any relationships. So other than the spouse who needs care, those spouses may feel that no one understands and they don't have anybody to talk about or talk to about their concerns. This is where support groups come in. And while everybody still has a different situation, daughter, son, husband, wife, grandparent, grandchild, while everyone has different situations, we want to focus on the commonalities because many of the commonalities are stressors. They're also the idea of self-care and how do we take care of ourselves? How do we maintain relationships with people outside of the caregiving situation? How do we become more educated? This Wednesday night on my radio program, we are talking about self-care for caregivers, a very important subject because caregivers are not always good at taking care of yourself. Join me. I also have a special guest. We're going to be talking about antibiotic use in the elderly. So as a caregiver, it's important, we'll close on this thought, is to take care of yourself, both emotionally and physically, because much of the research shows that caregivers' health suffers from taking care of other people because we don't take care of ourselves. We may not go to the doctor as often as we should. We may give up exercising, may give up outings with friends. Everything is important for the caregiver for self-care so that you can continue to be that caregiver. Caregivers who feel like their life has ended because of caregiving, you have to go a little further to gain support, to make the effort, to make new friends, to make acquaintances. And sometimes in that situation, it's easier if it's other caregivers because they already understand. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, helpful information for caregivers and aging adults. Have a fabulous day today. I will see you tomorrow in another video.